Welcome to Princeton Community Hospital. We are a fully accredited acute care facility serving a 10-county region in southern West Virginia and southwest Virginia. Our community-owned, not-for-profit hospital was established in 1970 and now offers highly advanced medical technologies and procedures. We are proudly located in the heart of Mercer County, West Virginia, an area rich in culture, history, and natural beauty. The city of Princeton provides a progressive business environment while preserving traditional hometown values. The area enjoys a pleasant four-seasons climate with numerous outdoor recreational opportunities. Nearby state parks provide mountain views, hiking trails, fine dining, boating, and much more. Winter Place Ski Resort and world-class whitewater rafting are minutes away. Prestigious colleges and universities offer full curriculums, outstanding libraries, and cultural opportunities. In December 2017, PCH's Orthopedic Center launched a new comprehensive joint replacement program based on a national best practice model for hip and knee replacements. The program has been very successful. In January 2019, PCH became the first hospital in West Virginia to obtain hip and knee certification from DNV. We will explore the new joint program in this presentation.
We hired a navigator for the patients to have contact with. This is the nurse's full-time job. She's a certified nurse in orthopedics and provides one-on-one support and contact with patients. Patients are educated on what to expect, right down to the last detail, once they have their total knee or total hip surgery, making sure the patient is in the best condition possible before they come and have their surgery, and also to make sure that they know how to prepare their home and be ready for their post-operative course at home. When you come to Princeton Community Hospital to have your hip and or knee surgery replacement, we're confident you're going to go home with very little pain, able to move about your home, able to get to your physical therapy appointments, have all your questions answered, and feel like you've had a great experience.
We are talking about knee and hip replacement. These are procedures that can help you walk again when arthritis makes every step painful. Joint replacement is a complex, high-tech operation. It requires technology and specialized skills. It can improve your life, but there are also risks. Joint replacements are done at many hospitals. Ideally, you want a place that specializes in joint replacement surgery, does it well, and with a low complication rate. So how does a patient choose the best place to have surgery? Most of us are not experts at evaluating statistics about complications or success rates. DNVGL is a global company that is expert in just that. Medicare and CMS use them to evaluate hospitals. We invited them to evaluate our program, and I'm proud to say the Joint Center at Princeton Hospital is the first program in West Virginia to be recognized as a center of excellence in joint replacement. DNVGL told us that few community hospitals are able to meet the strict standards required to receive designation as a center of excellence. They looked at every aspect of our program, and our program passed with flying colors. So technology and quality are a given at Princeton Community Hospital. What's really exciting is what's different from a patient's perspective. The Orthopedic Center is a dedicated unit specifically for the joint replacement patient. Patients can expect less pain, less nausea, and expect to walk sooner. The program is about wellness. Patients eat good food. They wear athletic clothes, not hospital gowns. And the best part is, the patients love it. They get up and walk within hours of surgery. Greater than 85% of them go directly home rather than to a rehabilitation center first. They go home faster and feeling better. Many of our patients describe it as the best experience they have ever had in a hospital. And we strive for every one of our patients to have that 5-star experience. So what are the parts of a center of excellence? It's a dedicated unit with private rooms. Patients are better prepared for surgery, knowing exactly what to expect. Most important is a dedicated trained staff. The staff works together like a finely tuned timepiece. Everyone you meet in our program has special training to help you recover quickly and get the best possible result. Every patient also becomes a part of the program. You and your fellow patients will be invited back for a reunion luncheon with us. We'll ask each of you to tell us something we can do to make the program better. Technology It's important. We constantly evaluate new procedures and technology to offer the very best to our patients. So from the operating room through full recovery, rest assured that you have a great team doing an outstanding job on your joint replacement right here in your community.